Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Bunga Maharani from English Literature of Sunan Kalijaga University. In today's presentation, I would like to talk about climate change and its impact on humans' health. This presentation will be divided into 4 sections. First is the introductions of what is climate change and what causing climate change to happen. Second is the impact of climate change on humans' health. And third is what can we do to protect health from climate change. And the last one is the conclusion and recommendation. This presentation will run approximately for 5 to 6 minutes. In the first slide is the introductions of what is climate change. Before we know what is climate change, let me tell you what climate is about. So climate is the product of interactions between atmosphere, oceans, land surface, and ice covers. These interactions can change because of some external factors, such as changes in the balance of the outer edge of Earth's atmosphere between the incoming shortwave solar radiation and the outgoing terrestrial long-wave radiation. And these factors vary naturally around the world without an obvious notice, and at the same time maintaining various natural and ecological systems. However, this variation has gone beyond natural levels, that climatologists are now in the same agreement that this world has begun to experiencing the process of global climate change. So based on those definitions, we can say that climate change is a change in the patterns of weather and related changes in oceans, land surface, and ice covers occurring in the time scale of decades or longer. So now we move into the next slide. In this slide, we're going to talk about the cause of climate change. What causing climate change to happen? So humans are increasingly influencing the climate and earth temperature. They burn fossil to make fuels that will produce a lot of carbon dioxide and nitrous oxide. And these gases are very dangerous to the atmosphere. That's why we need trees that will absorb all those carbon dioxide. But sadly, humans are also cutting down forests. And if they're cut down, it means that the beneficial effect is lost. And those carbon dioxide will be released into the atmosphere, adding to the greenhouse effect. And because of this greenhouse effect, climate change happens. So basically, the major causes of climate change to happen is because of the greenhouse effect. So after we know what the definition of climate change, what causes climate change to happen, let's see what is the impact of climate change, especially on humans' health, the topic that we're going to talk about today. In human, health impacts of climate change cannot be separated because the effect is very likely to be synergistic. In healthy individuals, the efficient regulatory heat system enables the body to cope effectively with thermal stress. So if temperature exceeding comfortable limits, both in warm or cold range, this will substantially increase the risk of illness or death. So the various potential of health impacts upon humans' health can be divided into 2. First is direct effects. The direct effects is related to the weather. So if extreme weather happen more frequently, the increase in rates of death, injury, infectious diseases, or psychological disorders would result. And the second is indirect effects. There are 2 major impacts of climate change upon humans' health. First is the cereal crop production. This might sound weird for you that the cereal you ate every day as a breakfast would actually be the major impact of climate change upon humans' health. But this is true. This impact would happen from the effect of variation in temperature or moisturize upon the growth or photosynthesis of the cereal crop, as well as from the effect of plant diseases or supplies irrigation water. There's also another important indirect impact of climate change upon humans' health. That is the transmission of vector-borne diseases. Temperature and precipitation changes might influence the biographical or geographical distributions of the factors which are the major causes of mortality in most of tropical countries such as Indonesia. So those are the major impacts of climate change upon humans' health. After we discover there's a lot of impact of climate change upon humans' health, then what can we do to protect it? What prevention that can be provided to protect our health from climate change? This will lead us into the next slide. How to protect our health from climate change. Global socio-economic development and health intervention have improved the general standard of living in recent times, but the resulting deteriorating of global environmental conditions are now affecting humans' health. So first thing is mitigation. Humans' activities have increased the atmospheric concentration of greenhouse gases. There are carbon dioxide, CFCs, methane, and nitrous oxide. So mitigation to reduce depletion of the ozone by CFCs can be achieved by national and international restrictions for their production and use. But since CFCs are the primary refrigerant used in air conditioners, the international community should spend more time and energy to find the replacement for them. We need healthcare too. Our healthcare would need to be responsive to a broad range of emerging threats of health. To protect health from the impact of climate change in the years ahead, patients and doctors would need to be on a lookout for the early signs and symptoms such as heat-related illness. Our healthcare also needs to be collaborative with sectors of the community. To protect health from the climate change, doctors and other health professionals will need to collaborate with communities and other organizations in areas such as disaster preparedness, disease surveillance, and advocacy. So that would be the last discussion of today's presentation. But before I close this presentation, there will be a few conclusions and recommendations. Climate change is not only an economic issue, it is a threat for our super system. So our generation must protect our health from climate change. We must begin to design and adopt an ecologically acceptable strategies in our all activities, which ensure sustainability. In other words, sustainability of our socio-economic effort should ensure that the component of ecosystem would remain intact and productive, so that the life on Earth is able to continue to drawing sustenance from them. And in addition to mitigation and healthcare, it is also important to increase public awareness. So if you have more knowledge or understanding regarding climate change, it is your responsibility to educate them. Teach them how important it is to know and realize that climate change is real. So I think that is the end of this presentation. I have a little recommendation, very simple, that it is very important for working groups to contribute to protecting our health from climate change. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.